cultural sensitive care for Hispanic patients and their families. In the Hispanic culture, a culture that is driven by a patriarchal mindset, a strong sense of family, a strong heritage of background beliefs, health problems can sometimes be compounded by a multitude of things that nurses need to have a working knowledge of when dealing with Latino and Hispanic patients. Hispanic culture, when it comes to healthcare beliefs and values, are much like many other things in the Hispanic culture where family is involved in healthcare decisions. Sometimes superstition, definitely spiritual undertones, and hot and cold theory of sickness and wellness is attributed to their values and beliefs. Hispanics, which are predominantly Catholic, believe in the anointing of the sick, paying penance, and praying over the sick. Hispanic culture tends to view health from a synergistic point of view. This is expressed as a continuum of body, mind, and spirit. Practices of Hispanic folk medicine based on the belief that illnesses are caused by hot and cold diseases are a common belief. Hispanic women may not ask important questions due to trust or confidence. Hispanic women need to feel a sense of trust and confidence to discuss personal issues. Topics and subjects like women need to be examined like women, by women, asking males to leave the birthing room, mothers usually accompanying women during birth, and abortions are taboo are all common beliefs and values that women hold in the Hispanic community. Hispanic children, much like women, trust has to be gained. Eye contact needs to be avoided for prolonged periods, and touching within the appropriate area of shoulders and head is commonly accepted within the Hispanic culture. Young adults are more open to modern technology and to the educational aspect of present-day health care. Older adults in the Hispanic culture tend to be non-trusting and have a tendency to have more strong spiritual beliefs, borderline superstitious beliefs. Males will have a tendency to exhibit machoism when it comes to not admitting pain, and the elderly are commonly unlike the society in the U.S. Nursing homes are not utilized in the Hispanic community, and the care of elderly is left largely to the women of the Hispanic families. The Hispanic communities have a need for education on immunization, education on dietary and nutritional values. In summary, nurses can provide a very important part in the aspect of reaching the Hispanic community, since nurses many times are the ones that have primary contact within the medical community and deal with Hispanic patients more frequently than doctors or PAs. The more nurses can gain as far as knowledge of the Hispanic culture, core beliefs, values, then this would help to bridge the gap between the medical community of the U.S. and the Hispanic community. Since the Hispanic population is the fastest growing population within the U.S., there is an important need for this gap to be minimized.